saints, through Our Lady, through our Lord, we prevail. I'm undecided if I will go back to the VA, at least in Saginaw, because I'm tired of that. Every time they they tell me come back, for more blood tests every single time, and then nothing happens. I mean, the only thing different this time is that they said they ordered a A1C3 or no A1C. I think it is A1C3. I think that's the marker. Or no, it's not a marker. It's a blood glucose average or a mean. But anyway, it's supposed to be fasting, and I always go back. It's always the same thing. I go back and give them a fasting glucose. Nothing happens. They have to have it. We got to be close to at least 10 to 15 blood glucose draws, at least. We have to be around there. But they didn't. That nobody reads medical history, and that I'm the kind of person that ticks me off. If they read my medical history, they know that the medication that I'm taking for the mass, the bacteria that's around the mass that's causing irritation. You have to eat food with it, or drink milk. See, but me, when I take those two antibiotics, if I don't eat a meal with them, it's almost as bad a reaction as ibuprofen. I will vomit. I've taken both of them before, so I know my reaction if I don't eat. So how are you supposed to give a fasting glucose when you're taking medication that requires you to eat a meal with it? Absolutely ridiculous. So I chose the same meal that I've liked for years. Well, one of them, my preferred great meal is Filipino and Chinese breakfast with chili garlic sauce and eggs and bacon and tocino, but I can't eat that anymore, and some or sausage. Some kinds of sausages are good too. Let's see what else. Oh, you gotta have your tomato and let's see what else. Oh, then a bagel with some kind of berry cheese on it. I'm on a pumpernickel kick right now. Actually, we all are in our house on a pumpernickel kick. And let's see, what else would I add to that? Oh, I gotta have my hash browns. They're kind of like McDonald's hash browns, except we bought them from the supplier. Well, from one of the suppliers. Oh, I guess that's about it. That's a good breakfast. If any of those meats could be vegan meats, oh, that's even better. But sometimes it's hard to find them. But anyway, so I had very small breakfast to take my medicine with 4 grams of sugar. So my testing will be off by 4 grams, which when you calculate it out, it's about 20 points on the blood glucose scale. Because generally, it's 3 to 5 points per gram. Generally, the kind of sugar that's in it, it depends. But that kind of sugar that's in those two, I guarantee it's regular, just table sugar. Regular from beets. So it's probably going to be around 5. So that's around 20 points. But now if they'd use cane sugar is a little lower. It's like cane sugar is, I think, 2 to 3 points per gram because it has a lower glycemic index. And if they use something like stevia, which would not taste good in a bagel, or honey, or agave syrup, it would be even lower than that, maybe around 0.5 or 1. Very low glycemic index, almost nil. But there's slight there, slight, very slight. And also that includes the bagel too, because the carbs, most of those carbs will become sugar. So you gotta calculate that a little bit too. But we're less than, overall less than 20 to 30 points of on the glucose scale. So we'll just figure in for that because I have to take that medicine. But you'd think that your provider would read the medical history. That's the thing that frustrates me about a lot of providers in mid-Michigan. I guess when you have troubled kids, who do you blame? Their parents. So I guess we would blame the medical school. Nobody is harping on people to read medical histories. Nobody is, apparently. You cannot give somebody good treatment and to fully address a medical issue unless you know if there's another underlying one that caused it, or if they have we call them in psychology comorbidities, which is pathologies that occur together, like bipolar with mania, schizophrenia with auditory, stuff like that. You gotta read your medical history. Anyway, it's not just on them for sending me to do this test. It's seems to be a rampant problem. And you can also blame in private medical world, blame it on the insurers. Especially if they're a high Medicaid contracting health clinic, because their profits are lower, and so they cycle their patients faster. And I've known some great doctors that when they're at the VA, they're a completely different doctor. We know a great Filipino doctor that when he was at the VA, he was an awesome doctor. But when he's in private practice, they cycle so much. And there's so many office wives in that office, I could tell it stresses him out. I could tell. But he's completely different at the VA, completely different. But you got to calculate that stuff in too. You may be cycled a lot, but still, I guess the insurers don't care. Technically, the health insurance, the insurers are different from the malpractice insurance for the provider, so they probably don't care. They're like, oh yeah, you have this patient was put on a 15-minute cycle. Matter of fact, all your patients today are on a 15-minute cycle. That's big money right there. Or a 10-minute cycle, even more. But 10-minute cycle, that's, some courts don't like that. They find it almost negligent. So most providers will go with anywhere from 15 to 45 minutes. Now the 45-minute health, visit, that's generally those are smaller clinics, maybe rural. Generally you'll know your provider better, but you don't know who you're getting. You could be getting somebody that's very educated, or you could be getting somebody that wants to be rural so they can leave work quick. And they don't read studies. No, that's for 1 month before my my annual what do they call that year? Continuing education credits, continuing, what do they call them? MEUs, medical education units. Yeah, that's for 2 to 3 months before my MEUs are due. So, that's sad, but yeah, some providers, they don't read anything anymore. They graduated, shoot, not gonna open up Science Direct or NIH.gov. No, got too much to do. So, yeah, medical histories. Maybe remind your provider when they come in very politely, yeah, did you get a chance to review my history, in a positive manner? Just to remind them, and then watch their reaction. You can't tell people how to spot a liar, but generally you get delays or you get bad looks or hesitations or somebody will just say it so quickly, but it's almost like they're aloof or they brush you off. They're lying. And lying is a horrible thing. We all know that. Lying is an abomination. So how you handle that one if you think they're lying, I don't know. I'm the guy that gets targeted all the time and flagged. But try to find a provider that's honest and does read your medical history, because it can make the difference. It really can make the difference in a lot of stuff.